Good morning from WKYT News. I'm Bill Bryant. We welcome you to Kentucky Newsmakers. It is back to school time, and later we'll hear from Kevin Hall of the Fayette County Health Department about the checklist for parents getting ready for students to go back to school. But first, weeks of drama and suspense have ended for Kentucky Governor Andy Beshear, who was considered by Vice President Kamala Harris to potentially be her running mate. Beshear traveled the country extensively, making stops in Iowa, Georgia, Oklahoma, and Chicago as he demonstrated his support for Harris. In the end, she chose Minnesota Governor Tim Walz, who Beshear considers to be a good friend. In a one-on-one interview with Governor Beshear, I asked about how his family dealt with all the suspense and what his priorities are now that he indicates he intends to serve out the rest of his term. Here's the interview. Governor Beshear, thank you for giving us a few minutes. How do you describe the last few weeks when you've traveled the country, were vetted to be on the National Democratic ticket? It certainly had to be a whirlwind.
Well, it's an honor. It's an honor to be considered. And how many people in their lives get vetted to potentially be a vice presidential running mate? But the thing I've loved the most about it is how we, Kentucky, have received hundreds of millions of dollars of positive publicity, of positive attention. You know, people out there are writing about our economy, our achievements, how we're working together, and the special things we're doing. So all of this is worth it because people in this country have been looking up to us and not down at us, and it's going to help us in our work moving forward.
Could you be tempted to take a cabinet position if Harris were to win and that were to be offered?
You know, I was touring Eastern Kentucky about 10 days ago, looking at all the good work that those communities in the state have done in rebuilding for those that experienced the worst flooding in my lifetime. And it really hit me looking around that I'm exactly where I'm supposed to be. So I look forward to showing up every day the next 3.5 years to serve the people of Kentucky. Now, over these next several months, I'm going to work really hard for the Harris-Walz ticket. I'm a big fan of the vice president, and Tim Walz is a good friend of mine. But listen, I've got a dream job right here being governor. My family is happy. The state has been so good to us. The town of Frankfort makes my kids' life as normal as it can be. I am really blessed and thankful for the spot I'm in. Was
that a big consideration for you, keeping your family as normal as you could, knowing that this could take off and you could be away from the state and try to find a way to operate state government and also travel aggressively?
Well, it's something that certainly pulls on your heart. My kids were so supportive during this entire process, but I love being dad. I love making baseball games. I love going to horse shows. If I could have helped the vice president win this election, it's something I would have very strongly considered. But for Tim Walz, a good friend and a great man to be on that ticket is a wonderful thing. It's a wonderful thing for Democrats in the election. It'll be a wonderful thing for the people of the United States of America when he's our vice president. And I am really happy being here in the Commonwealth and getting to be home being dad a little bit more than I would have otherwise.
Governor, can the Harris-Walz ticket be competitive in Kentucky?
Well, we'll see as it goes forward. You know, what I hope, though, is that we have a future where 5 to 7 states don't determine the presidency every 4 years. You know, in my travels to Iowa and my travels to Oklahoma, people feel the same way that we do here. I mean, they want to be a part of these decisions. So having competitive states in both directions is so important to them being a part of one of the most important decisions that are out there. And I think we're getting closer, Bill, because every place I go, people are so tired of the constant partisanship. You know, the world isn't red or blue, D or R, and the things that matter most, like good jobs, infrastructure, healthcare, public education, and public safety, they're just not partisan at all. And I believe that the Harris-Walz ticket, when they become our president and vice president, are hopefully going to lead us into a future where we are Americans first and Republicans and Democrats second, where we leave the nastiness and anger politics of these last 8 years behind us. That's my hope for the country, and I'm pretty proud of how we're getting there as a state.
Do you anticipate traveling extensively in the fall campaign for the Harris-Walz ticket?
I'm willing to help them however they ask me to. Again, I think the vice president is smart and strong, which will make her a good president, but she's also kind and has empathy, which can make her a great president. And I know Tim Walz incredibly well. He's a great friend. Nobody helped my reelection more than him. We've gotten really close, and he is going to campaign as hard as anybody. And he is a big get and a big value added to this ticket.
Well, he was at your inauguration and took pictures, and there are pictures of him taking pictures and all of that. How did that come about?
Well, he was at Derby, too. So I remember a year before my reelection, I think was his. And I remember walking into the elevator at the conference that we're at, and it's like he's walking on air. And I said, Tim, I want to feel that way. And he looked back and said, Andy, I want you to feel this way too. And he worked so hard during the course of my reelection to make this happen. And this year he was the chair of the Democratic Governors Association, something he just stepped away from to be the vice president's running mate. But we've developed a close friendship where we talk about family, where we talk about the challenges we face. He is a good human being. He served in his National Guard. He was a teacher, a coach, and a lunchroom monitor for more than 20 years. And if Congress needs something and somebody will break ties, it is a lunchroom monitor.
Does the end of the Veep stakes, and so now this chapter is over, and he is the running mate. Does this give you a chance to, as you have noted, refocus on your commitment to Kentucky, and what would your priorities be heading toward the next legislative session and for the remainder of your term?
I want people to know I never left. I was working each and every day that this was going on for the betterment of the people of Kentucky, and I'm so excited to continue to serve as governor. We are in this historic moment with our economy where we have more potential than ever before. Number 3 in per capita economic development last year, number 2 the year before. The number one thing we've got to do is run as fast as we can to continue to build these jobs and bring in these companies, not knowing how long this window of incredible growth will last. We got to out-hustle everybody else out there, because everyone we bring in is another potential opportunity for our kids and our grandkids. And I'm thrilled at what we're all doing together, Democrats, Republicans, everyone, state, local, even people in neighborhoods smiling at somebody they don't know that's trying to decide if they can move their company and their family here. Everybody makes a difference. We've got to continue to fight for public education, to continue to raise wages. We were able to do that some for our educators this last session, but we need to do more to compete with Tennessee and Indiana. It is time for universal pre-K. It shouldn't be partisan. Georgia does it. Red states do it. Blue states do it. It's just smart. And when 50% of our kids show up to kindergarten not being ready, it's an investment that we have to make. And we've got to continue to provide accessible and affordable health care, to push forward the 4-laning of the Mountain Parkway, the Brent Spence Companion Bridge, and the I-69 crossing. We've got to continue to support our law enforcement out there to make sure we're providing public safety all across the Commonwealth. And we've got to make sure that we continue to put our people first and to never try to drive a state to the right or the left, but just drive it forward, because that's the way everybody wins.
Governor, lost in the fast-moving events the last month or so was your trip to Japan and South Korea. Will that bear some fruit? Was that a promising trip?
It was. We've already had an announcement from Mitsubishi Electric about the future of a plant in Mason County. It's a really exciting announcement. We've got some others that are coming up. I know we kept one company in Kentucky that was looking at otherwise going somewhere else, and we got a firm commitment from some of our biggest investors from that region that some of our largest projects will continue. So yes, that trip was well worth it. It will bear fruit. I will tell you, the jet lag is real, and especially when you're 13 hours difference. That was something recovering, but it was well worth it.
How is your father, former Governor Steve Beshear, doing since his recent accident?
He's good. He's rightfully pretty private about his health, but he will heal and make a full recovery.
All right. Governor, thank you very much for giving us a few minutes. We appreciate it at the end of an interesting chapter, certainly in your life, and what was an interesting chapter for Kentuckians as they waited to see what would happen, but now we are aware of your future plans, apparently. Thank you very much for being with us. We appreciate it.
Thank you, Bill.
Everybody stay with us. WKYT's Kentucky Newsmakers will continue. Welcome back to WKYT's Kentucky Newsmakers. The school bells are about to ring. Students will be back together in those close quarters of classrooms. What are the rules for vaccinations and what checkup should students get as they head back? Fayette County has continued to see a number of pertussis cases. What precautions can be taken there? Also, Fayette County's been spraying for mosquitoes, and the health department is responsible for restaurant inspections. Kevin Hall is joining us from the Fayette County Health Department today, and give us an idea of what's going on this time of year. Thanks for coming in, Kevin. We appreciate it very much.
Glad to be here, although I'm not so sure I want to be associated with the return to school. That's just bad for some people to hear.
Or mosquitoes, right?
Or
for that matter. Well, we're glad you're here. But back to school is that time when the kids get back together after summer break, and they've been everywhere, and who knows what they picked up along the way. Why it is important to be up to date on those immunizations as the school bells ring.
Well, what we're seeing here in Lexington right now is a pertussis outbreak. We've not had anything like this in years and years in terms of pertussis. Right now there are 57 positive cases that have been reported just since the end of April. And if you look at the last 5 or 6 years combined, we had less than 15 cases. So this is bad, it's very serious, but fortunately that is something that is vaccine preventable. It's required. The pertussis vaccine, or whooping cough, the vaccine is required for entry into schools in Kentucky, and the booster is required at age 11.
Youngest and oldest are most at risk from pertussis?
Absolutely. It's going to be particularly babies. With children who are younger than 6 months, this is one of the highest, if not the highest, reasons for hospitalizations and deaths. And then if you have your older adults, so you're thinking about the grandparents, great-grandparents, aunts and uncles, they're going to be at a higher risk. So it's why it's important for anyone who's pregnant to go ahead and get that shot in the 3rd trimester.
Is there a concern that the pertussis vaccination rate is not high enough?
What we're seeing right now has really nothing to do with the vaccine rate being low, because most of the people of these 57 have been vaccinated, fully vaccinated. What we're seeing instead is the vaccine weakens over time. So when people get it at age 11, they get that booster shot. They need to get that. They need to get the booster again every 7, 8, 9, 10 years. It weakens over time, and so if it's been at least 10 years, talk to your provider about it.
So it's recommended even for adults of all ages?
Absolutely recommended for adults. If you're listening, you haven't had one in 10 years, talk to your provider.
Very interesting. What other vaccines are required in Kentucky?
So things like again, it's Tdap, so tetanus, diphtheria, and pertussis, so things like the polio vaccine. So these are going to be shots that are part of your routine schedule for caregivers. But what we want them to talk to with their providers, so whether it's your pediatrician or your health department in whatever county you happen to be viewing this in, is make sure that you're up to date on those. What happened during this COVID pandemic is so many caregivers got thrown off schedule because they were staying home. They weren't going out unless they absolutely had to. Maybe they got thrown off by a week or two. Maybe they got thrown off by a year. But it's time to talk about those vaccine schedules with your providers.
What other services are available that, across Kentucky and certainly here in Fayette County that people may not be aware of through the health department as school is starting or any time of the year?
Well, in some health departments, I know that they've been giving physicals. That's been part of that. Here in Lexington, it's really making sure that you're up to date on your vaccines. And something that's important for those caregivers to remember is ask for multiple copies of that vaccine record. One to take to your school, one to be able to have on hand. That's very important to take as you enter school, and particularly if it's a kindergartner or a new school to your child.
Kevin, public health had such a moment, we'll say, during the pandemic. We'll say it had the spotlight for difficult reasons, right? It had long been said that the country needed to be ready for a pandemic situation, and then here it came. Were we ready? Would we be ready again? Or once that light has dimmed some, do people go back to as they were?
Those are great questions. I think we were ready in the sense that you look at how many people were able to respond so quickly to get a vaccine up and running and to protect people as much as possible. What we ran into, though, was just a very strong disinformation campaign, and that worries me in the event of something else that happens. And it's going to be a matter of time before we have another pandemic. It's too likely that we're going to see something happen again. Maybe not in my lifetime, but in our children's lifetime. To be ready for this, we need to make sure that we go back to the science and the facts on vaccines, and go back to those early days of COVID when we were checking on each other. We weren't fighting about it. It hadn't been politicized. It was just about taking care of our neighbors.
It's been said the RNA vaccines may also have provided some other benefits going forward, cancer research and in some other areas, as I understand it.
Well, this is why these are left in the hands of the scientists. These are people who have dedicated their lives to making this world a better place, whether it's in terms of the vaccine or vaccine research or just medical research. These are people who are trying to save lives. That's why I trust this vaccine and the people who are creating them.
Do we invest enough in public health, in your view? And I know that's you're the spokesperson. I get it, not the political wing, but you know what's going on out there.
I don't think there's enough financial investment or just personal investment into public health. I will say it, or the political investment. It's been it's been made a left versus right in terms of public health, and that's not what this should be about. Public health is about the public. It's taking care of everyone. Our mission at the Lexington Fayette County Health Department is helping Lexington be well, not helping part of Lexington, not helping this segment or the people who vote like us be well. It's all of Lexington.
When there's a recall, like the recent Boar's Head recall that has brought listeria to light, does the health department have a role in amplifying that information?
The good news is something like that, it's so large scale that the places that it's being sold, they reach out directly to the providers. I, for one, got a robocall from the grocery store saying, if you've purchased this, I need to take steps to throw it out and get a refund. What we really work on are those smaller recalls and reaching some of those mom and pop shops that might not have received that notification, or things where a couple of weeks ago where you had that Diamond Shrooms recall where it wasn't as regulated on who might be selling that. So we do try to amplify those messages.
We know the Fayette County Health Department does restaurant inspections. Does that extend also to the school cafeterias and food preparation for schools?
Any place where food is sold, so concession stands at the Little League ballparks, Rupp Arena, movie theaters, so that box of popcorn that you're getting when you watch Wolverine and Deadpool this weekend, that place was inspected by the health department.
Food trucks.
Yeah. That's a thriving one. Or temporary food establishments. So think about the different
Pop-ups,
festivals and the pop-up establishments.
How often do those occur, and are they thorough?
It's at least twice a year, and they're very thorough. They have a huge checklist of things that they go over, and it starts the minute they pull into the parking lot. They're looking for any signs of grease contamination or improper dumping in the parking lot, and it carries through all aspects of the restaurant.
The Attorney General of Kentucky, Russell Coleman, has raised some questions about the effectiveness of the needle exchange programs in the state. He says if he thought it worked, he's for it, but there are questions that it could be enabling rather than preventative. Your thoughts?
The only thing that harm reduction enables is it enables people to keep living until they are able to get treatment. We've seen it here in Lexington. Our program's going on 9 years since it first opened, thanks to the leadership of the late Rice C. Leach. We have had hundreds of people, I can't remember the count off the top of my head, but hundreds of people who have successfully entered recovery programs. We've kept hundreds of thousands of used needles off of the streets and out of the playgrounds here in Lexington. And what we have done is just provided hope to the people who need that. Harm reduction is about meeting people where they are and reminding them that we love you, we care about you. And harm reduction is not just about needle exchanges. Somebody who takes a diabetes class, that's harm reduction. Somebody who wants to quit smoking, that's harm reduction. Too much of it gets focused on the needles, but that's really because that draws attention. That gets people fired up. It gets them angry, but it also gets the other side involved as well, to remind people that these are humans, these are aunts, uncles, moms, dads, children. These are important people of Lexington.
It was in part sold to the public, though, under the idea that people would be pulled in and would then be able to be counseled and get more information, and there are questions as to whether a lot of that is really happening.
I can't speak for any other health department or any other harm reduction program, but in Lexington, people who come in, they get treated like humans. They get reminded that you matter. When they want to begin that conversation about recovery and options that's available to them, and hundreds of people have taken advantage of it.
There's been a lot of mosquito spraying going on in Lexington this summer. Is that problem worse than usual, or is that a routine annual situation?
In terms of spraying, this has been a very light summer. We've only had to go out in terms of doing the spraying twice. That's based on a threshold on traps throughout the community. Now, if someone has a problem in their neighborhood, call the health department and let us know. We can look into that. What we really want people to do, though, is take a walk around your home and eliminate standing water. A mosquito can breed in as little as a teaspoon of water, so it doesn't take much. It can be in the back of a Tonka truck sitting on the ground. If you see standing water, dump it out.
We haven't heard a lot of reports of West Nile in this area or any of the other harmful diseases associated with mosquitoes, right?
That's correct. And that's part of the campaign of why it's important to fight the bite, as the state has put out, and it's getting rid of that standing water and getting rid of the mosquitoes. We don't have to spray if we don't want to, if we don't need to, so people can take those steps on their own.
There has been no health commissioner in Fayette County for more than a year. I know that is a Board of Health decision, but is the health department functioning normally, and don't residents have reason to question why a job has been open that long?
I don't think anyone would notice in the public that the position has been open because of the leadership at the health department and the people who are working it. We have world-class staff who keep that place running. So if you're coming out there, no matter if we have a commissioner today, tomorrow, or we're without one, you're going to still have world-class service.
Anything else we should know here at back to school time?
We're going to be heading into respiratory illness season, flu, COVID, and RSV. So when those vaccines are available, make the time to get those shots.
Do you have a time frame when those will be available yet?
The COVID vaccine is still awaiting, the new version of it is still awaiting that final approval, so no dates yet. But with the flu shot, we'll be providing free shots in October. More dates, or more information on that will be coming. And you're going to start seeing it available at pharmacies within the next couple of weeks if they haven't already gotten it.
All right. Kevin Hall with the Fayette County Health Department, thank you so much for coming. We appreciate it.
As always, great to be here.
And stay with us. We'll wrap up Kentucky Newsmakers in a moment. Welcome back to Kentucky Newsmakers. Recreational marijuana sales started this last week in Ohio. Businesses with dual licenses were able to start selling early Tuesday. In Ohio, you have to be 21 to legally purchase cannabis, and individuals can legally grow 6 plants with a limit of 12 plants in a household. But what about here in Kentucky? Could Kentuckians drive north to buy marijuana and bring it back despite it being illegal here in the Commonwealth? WKYT's Phil Pendleton and photojournalist Darnell Crenshaw look at the potential impact on Kentucky.
Fayette County Attorney Angela Evans has concerns about Ohio's recreational marijuana sales going live and Kentuckians shopping at a dispensary and potentially bringing it back into the Commonwealth.
And like you said, people coming back and using it or, have used it there. I mean, I am concerned about the driving under the influence. County
Attorney Evans wants to remind people that Ohio has its laws and Kentucky has its own state laws.
It's still illegal here, and that's what I don't want people to be confused about.
Lauren Bratcher is the Deputy Director of Kentucky NORML, part of a national organization that has fought to reform marijuana laws since 1971.
And I do think a lot of people are going to go to Ohio to purchase. People already go to all the other recreational markets like Michigan.
You risking being in trouble, which that I think it don't make any sense for real.
This man's talking about those who bring the marijuana products back with them into the bluegrass. He's been in trouble himself, and he says he caught a misdemeanor case for simple possession, 2 days in jail, and $1,000 in court fees.
And I didn't even have a gram.
He says he has plans to check those dispensaries up north, and he hopes Kentucky goes recreational soon.
It's so close, so more people going to want to go right there and bring it back. But hopefully they consume there and then come back.
In Lexington, with photojournalist Darnell Crenshaw, Phil Pendleton, WKYT.
Now, Fayette County Attorney Evans says her office has been handling marijuana possession cases with $100 fines. However, they can increase those fines depending on the number of related charges. Well, in eastern Kentucky, a town is hoping to confront high gasoline prices head on, or at least figure out how they're set. Salyersville's Mayor Stanley Howard has sent a letter to gas station operators in the Magoffin County town asking them to appear before the City Council on August 19th, or at least send a representative. The mayor says it will be an opportunity for them to explain how gas prices are determined. On next week's Kentucky Newsmakers program, we're hoping to hear from Fayette County Schools Superintendent Dr. Demetrius Liggins and from Dr. Aaron Thompson, who oversees Kentucky's colleges and universities. And a reminder that we're staying right on top of Campaign 2024 with coverage on air and online of the events across the country, as well as, of course, here in Kentucky. You can always visit us on WKYT.com or our WKYT News app for the latest as well. And that is Kentucky Newsmakers for this week. Thank you very much for joining us. Make it a good week ahead.